Hi there, this is Braedan with Total Outcomes Physiotherapy, and we got another video for you today. And what's this one about? Well, I know that everybody, when they have to go see their physio or their joint doctor or any doctor really, sometimes they have a hard time knowing how to make their case when they first meet that person, how to get their point across and what to be clear on. So we're gonna talk about some of the things when you're seeing a physio or joint doctor that'll make a big difference in how you manage yourself and make sure they get the information that's clinically relevant. Okay, so what is clinically relevant? So let's assume this is a musculoskeletal problem, so a problem with bone, joints, and muscles. The first thing I want to talk about is what we call onset time. So when did the injury actually happen? How long ago was it? Was it something that happened 2 days ago? Because that would look a certain way. Or maybe it was something that happened 6 months ago or 12 years ago. All of those would have a different clinical implication. So let's be clear, when you're talking to your doc, talk about when the onset time was. Now, the other one is the onset reason. So why did it happen? So did this happen because you had changed your sport and something started to hurt? Did it happen because you had what I call an ouch moment? So an ouch moment is defined as anything that you go, ouch, and you really, really wish afterwards that didn't happen. So usually with a real ouch moment, it's when you misstep or when something happens and you feel like you've wrecked something, and it's completely possible that you've damaged structural tissue. So for your clinician to understand how the injury happened, that gives them clues in terms of what types of injuries, what types of structures to look at. Okay, what else is clinically relevant information? So definitely that your physio is going to want to know where it hurts. So saying that your shoulder hurts is one thing, but saying that your shoulder hurts here in the front or here down your arm or here, or even some people back here they call their shoulder. So the word shoulder doesn't mean a lot. So actually showing them where it hurts makes a difference, and it's going to help them with their diagnosis. So you're also going to want to talk to your physio about what I'm going to call the weird stuff. So the weird stuff would be maybe if your joint locks, which means it gets stuck and it won't let go, or something like giving out, when a limb gives out and suddenly it just has no strength. Or also weird stuff could be any type of joint noise, maybe clicks or clunks, or even something, if we're talking about the neck, maybe dizziness, maybe that's considered weird stuff. So things that are strange, I think your physio is going to want to know. And again, that can point to different structures in the joint or different types of problems. So other than that, you want to be clear with your physio on your activity tolerance, telling them exactly what your body tolerates. That's really helpful for them. So that might have to do with how long you can walk, when your pain comes on, when you stand, is it after 30 seconds or is it after 7 hours? Okay, likewise, how long you can sit for, if there's a certain chair that you can sit in but not the other chair. So activity tolerance, how much weight can you lift? Does your wrist hurt when you lift a tea kettle, or do you have to lift a sack of potatoes to make your wrist hurt? That gives the person an idea how acute the problem is, how irritable it is, okay? What is the pain's behavior at different times of the day? So do you feel the pain in the morning? Do you feel it at the end of the workday, or do you feel it at night? Those are all point to different pathogenesis of the injury. So also, you're going to want to let your physio know if there's any past spinal pain history, even if it is an elbow or a wrist or a shoulder. The neck is always something that they're going to be interested in, so is the low back. So let them know what sort of problems you've had with your neck and low back. Now, those are the things that are clinically relevant, but now let's talk about what isn't relevant, because I think some of the performance anxiety that precedes going to see a clinician and telling them about your case, I think some of it has to do with because you don't want to do the things that aren't useful. So here's what isn't clinically relevant. So, why you crashed your motorcycle or why you fell off the porch, it doesn't really matter. It's just that you did crash your motorcycle and that you landed on your head. That's enough for the clinician to know. They don't need to know the reasons why. So if you want to be efficient with the time, make sure you know what your story is. You don't have to embellish it with all the reasons. So almost the polar opposite of that is when people won't answer the doctor's questions, and they just, you ask a straight out question and they just sort of sidestep it, and they look at you like, why would you want to know that? Well, trust me, I'm not asking for general interest, so there's probably a reason why I want to know. If I'm asking a specific question, just answer the question. It's that easy. So now here's the other thing that isn't clinically relevant. So excessive description of the quality of the pain. So sometimes the quality of the pain is a good clinical clue. Okay, sometimes, let's say if it's a nerve problem, it might be burning. Okay, maybe it's a different thing, whether it's a sharp pain or whether it's an ache. So it's not that I don't want to hear these descriptions, but excessive description. So the physio is going to want to know the intensity of the pain, whether it's nominal pain or pretty bad or maybe even severe. And then mostly they're going to want to know the behavior of the pain. So the pain does this when I do that. Okay, I look up and the pain shoots down to my wrist. Those things are really useful in diagnosis. So I hope that was helpful for you. I hope you get the help that you need, and feel free to check out some of our other videos, and you have a great day.